Soweto, South Africa's largest township, lies just outside Johannesburg. Affectionately known as Bara, Soweto's only hospital sprawls over 173 acres, has 429 buildings, and 10 kilometers of corridor. With over 3,000 beds, it serves a population of about 4 million people. Named after Cornish settler John Albert Baragwanath, the hospital added the name Chris Hani in honor of the ANC activist murdered in 1993. The trauma unit is one of the hospital's busiest departments and is always particularly hard hit on payday weekends, when alcohol flows freely in the townships and violence erupts.
Oh, they stabbed me, man. They stabbed me with a knife.
His brain and C-spine?
We did a C-spine X-ray, but apparently...
You've got a stab in your neck. Yeah. It's a big stab in your neck. And you're going to need a scan so that we can see if there's any vessels damaged there.
This dude can wait outside. He must also wait outside.
I'm from the west of Ireland, and in the last 8 years I've been working in Glasgow. I was working in emergency medicine. Bara is probably one of the busiest trauma units in the world, and I came for the experience here.
It's 7 o'clock. It's 24 hours to go. It's the end of the month, so I'll pretty much try and clear this by about lunchtime, and then it'll start again. So his abdomen's not good, hey?
Hold on.
Kajal is an intern in the trauma unit. Her first patient, Isaac, has multiple stab wounds.
Good morning. Sister, we got another one coming in. Okay, it was... He's assaulted. He's got surgical emphysema though.
Hey, well.
Hello. How are you? What's your name? Isaac. I'm first year intern. At the moment I'm doing trauma.
The experience doctors gain at Bara has given it worldwide renown as a teaching hospital.
Patrick. He's got surgical emphysema all the way from the neck down to the abdomen.
Okay.
Can't feel any fail segments or fractures.
What's his mechanism?
He was assaulted, he was kicked to the chest. There's a lot of patients that come in assaulted. Because this is the end of the month, it's payday, it's exceptionally busy. What's wrong?
They used a tin of jam to stab.
They used a tin of jam, a cut tin to stab him.
Okay, we're going to put this man to sleep, and we're going to put a tube down and take over his breathing, because his conscious level is not high enough to protect his own airway at the moment, and he needs scans. He's very difficult to assess in any other way. I think he's got a mandibular fracture. Do you want to do the tube? Okay. His aide here is going to do the intubation. I'm just going to supervise him. Okay.
So what we'll do for Isaac is we'll suture the laceration. A lot of this is people getting drunk and getting into fights with people they know. We see a lot of stabs to the chest, to the body, to the heads.
When it gets busy, we have probably about a third of the amount of space that we need. We don't have enough staff, we don't have enough nurses, we don't have enough doctors. We don't have enough equipment. A lot of the equipment doesn't work or breaks when you need it.
What access do we have? Is this working?
After battling for 20 minutes, Kajal gets Isaac's bleeding under control.
Now he's fine, his level consciousness is 15 out of 15, so we're going to leave him outside for somebody to suture him to make space if anyone else comes in, and because this place is already full. It's often very frustrating because I think Bara, more than a lot of other places, is grossly understaffed. They're under-resourced as well because of the limited budget.
10 o'clock in the morning, and already we've used up all our ventilators now. There's not a single ventilator left in the hospital, and this is the last ventilator in resus. And we've got Saturday night festivities still to come, so I don't know how we'll manage tonight, but this happens most weekends.
As the number of patients waiting to be seen mounts, Kajal finds room for one more near the fire escape, where drunk and disorderly patients are restrained while staff wait for them to sober up. It's mid-morning, but the unit is already full to capacity.
All the other hospitals in the city are shut. Hello? So we're the only one that was open until 7 o'clock this morning. We've now asked to shut for 2 hours to give us a chance to try and clear this, because we can't resuscitate any more patients. We don't even have room for them. We have no ventilators and we have nowhere to put them. So in reality, patients will continue to come.
With staff shortages a constant problem, interns like Kajal are heavily relied upon to keep the place functioning, and despite their lack of experience, are often faced with life and death situations.
You're getting in the right place, but then you're doing that and blocking your head. Okay? Because we have such a shortage of doctors here, our interns are left unsupervised an awful lot of the time. Most of the time there is someone more senior around to supervise them, but occasionally they will just have to do this without supervision. Did you get a view? Yeah.
Now,
Okay.
this
Take your
As
time.
senior doctor on duty, interns often call upon Patrick for advice.
He's very good with his procedures and his knowledge is amazing. You trust his judgment, so if you're not sure about something, you can go to him and you know he's going to tell you exactly what to do and how to do it. So he's lovely to be on call with.
Kajal collects Isaac's scan from the X-ray unit. He seems to have escaped serious injury.
On his brain, he's got no fractures or any head injury from the current trauma. So the lacerations on his head were just superficial to the skull. They didn't cause any damage.
Others are less fortunate.
I've just seen a lady who's been raped and violently assaulted.
I just need to sort out some investigations for her, and then we're going to get the gynecology doctors to come and see her and try and get forensic evidence to prosecute whoever did this.
A woman born in South Africa has more chance of getting raped than learning how to read.
No. Hit with a bottle, okay? Just on your head. There is a lot of violence here. I mean, South Africa has a significant problem with crime and with violence, and we serve a big population and quite a poor population, so you see a lot of it. I guess if you work in an emergency department anywhere in the world, then you see pretty much the worst of society and the worst of what one human can do to another. Every day we see people who've been murdered, assaulted, raped. What happened to you?
Treating victims of violence also carries personal risks for the doctors.
Hit you. Come over here and sit on the chair. You can see the amount of blood that's all over the place. We've got blood on our arms and covered in blood. Probably 50 to 80% of our patients have HIV, and quite a lot of them have hepatitis also, so we try and keep gloves on as a minimum. We should wear eye protection and things, but it's not feasible to wear it continuously for 24 hours. It's too uncomfortable. So. What time did you phone the ambulance? Was it when you were stabbed? Yeah, okay. So on a busy night, we often see this, people who've been stabbed, which is 10 hours ago now, and only coming to hospital now because the ambulances have been tied up with other cases. So essentially, time has told us that he's stable, so he's fit to go upstairs for an X-ray up to the main hospital.
Although Patrick's new patient Sipho has a serious stab wound, he must make his own way to the X-ray department, a 5-minute walk from the trauma unit. Patients often lose their way or simply disappear.
I understand was on the line.
Where is it?
At that side.
Outside?
Yeah, through the window in the recess.
This happens all the time. Patients go away, we might see them for hours and hours.
I saw you earlier, hey?
Yeah, sit up for me. Go back inside, okay? We sometimes lose people.
Sipho has returned from the X-ray department. He joins another queue and waits for a diagnosis.
In the UK, we have to get all, like 95% of patients discharged or admitted within 4 hours. It's a bit different here. They can spend 36 hours in the department. load of trauma from the weekend has now cleared. We've had a couple of fresh resuscitations, a couple of more patients there who need scanned, but we're getting on top of things now. Hopefully by this evening we'll have sorted out all of the backlog. Right, there's nobody dying right this minute, so I'm going to go and have something to drink because I can't do this all day.
Just as Patrick tries to take a break, 12 victims of a minivan accident are brought in.
Hello. Hello. Can you let go of your leg, please? Thank you very much. There is more car accidents here. There's a lot more pedestrian accidents. Stay nice and still. Stay still. You're in a taxi, hey? You remember everything that happened? You can answer your phone if you wish. Okay, can you bend this leg gently for me?
I'm on hospital.
That's great.
Please.
And this one? Good man. Fantastic. Okay, ideally this maneuver would be done with the patient fully undressed in a proper room, but as you can see, we're having to work in corridors here.
I'm so exhausted. I can't wait to get home.
There's still a few hours work out there without any more people coming in. But usually by about 10 o'clock it starts to get busy, and by about 3 a.m. it'll be wild.
Yeah, tonight they are coming.